Welcome to the first lecture of Module 6, and today we're going to talk about the development of physical fitness, covering chapters 15, 16, and 17. So just to outline this lecture really quick, we are going to talk about the development of cardiorespiratory endurance, strength and flexibility, and the changes that occur in body composition. And then we'll finish off by talking about motor skills and physical fitness. So starting off with cardiorespiratory endurance. So there are a lot of developmental changes that occur in anaerobic performance. Children have less anaerobic power output compared to adults because their muscle mass is smaller and their absolute quantities of energy reserves are smaller as well. Anaerobic output increases with age due to increased muscle mass and energy reserves, and an increased tolerance of byproducts of metabolic processes improves, as well as the improvement of neuromuscular coordination. So I didn't even define anaerobic performance before we started. So anaerobic performance is generally performance that is of shorter duration and higher intensity, and the primary source of energy used in anaerobic performance is glycolysis and CPR. So those tend to be stored up sources of energy that you have to use, versus aerobic endurance tends to be more fat burning, and you will use oxygen that you consume as you burn during those. So if your absolute quantities of energy reserves are much smaller, you are going to have less power output as a child. So as you mature and grow, so during childhood and adolescence, more mature children tend to have better anaerobic performance. And the gender differences do exist in anaerobic output, meaning that men do tend to have a higher power output compared to women, but this is reflected in muscle mass differences. So if a male does not have as much muscle mass, a woman is likely to have a greater power output compared to her. So as we mature, we will also have an increased anaerobic performance. Moving into adulthood and anaerobic power, once adult body size is attained, performance is fairly stable. The improvements reflect training alone, but there are also training effects that exist before puberty. In older adulthood, the loss of muscle mass can result in declining anaerobic performance. So, until we reach adulthood, most children will show improvements, but once you hit adulthood, the improvements are due to the effects of training. But if you have a child, for example, that has been training before puberty, they will have a higher anaerobic output compared to a child who is not training. Unfortunately, in older adulthood, as we've talked about in previous lectures, muscle mass loss results in declining anaerobic performance. Moving on to aerobic performance, there are a lot of developmental changes that take place here as well. Aerobic performance is measured by maximal oxygen uptake, and which is the largest amount of oxygen the body can consume during aerobic work. Since children are smaller, they have a smaller cardiac output because they have a smaller heart, which results in smaller stroke volume. And stroke volume is the amount of blood that the heart can pump out in one stroke. They tend to compensate with higher heart rates, and they also have a lower concentration of hemoglobin, which carries the oxygen in the red blood cells. Children do have a pretty efficient system based on their size, but they just cannot exercise for as long as adults can because of, as we mentioned earlier, their lower stroke volume, lower concentrations of hemoglobin, and the fact that their heart rates itself, resting heart rates, are a lot higher. Changes in aerobic performance that exist during childhood, the heart size increases as you grow, and the hemoglobin concentration increases as well. Due to these two changes, we increase the ability to sustain exercise because it's related to body size and maturation. In terms of gender differences, by late adolescence and into adulthood, trained men have an advantage over trained women, again, mostly because of body size. So, to talk about some training effects in children, Growth status and maturation levels do have to be considered. There's a trigger hypothesis that Catch came up with in 1983, and he found that hormonal levels of puberty are necessary for a sustained training effect. Aerobic training does yield small improvements at best in preadolescence, but the significant improvements that you see from training occur only after puberty. So there are training effects that exist, but they are very minimal compared to if you're comparing a highly trained 20-year-old versus a sedentary 20-year-old. The differences will be far greater than a trained 8-year-old and an untrained 8-year-old. In adults, through training, you can increase your maximal oxygen uptake, the stroke volume increases, maximal cardiac output increases, and ventilation improves. So training does have a much bigger effect on adults. Once you roll into older adulthood, aerobic performance tends to decrease due to changes in structure and function. The maximum heart rate declines significantly, and stroke volume in some older adults declines as well. Cardiac output declines due to a loss of cardiac muscle, loss of elasticity in the cardiac muscle, thickening of the left ventricle, change in valves, and loss of elasticity in major blood vessels. Remaining active can prevent large declines in aerobic endurance. So, by staying active, older adults can reduce the drastic effects of all the factors that reduce cardiac output, but most of these are fairly inevitable, where they will lose some cardiac muscle, but staying active can reduce the amount of cardiac muscle that they lose. Moving on to strength and flexibility. So strength is defined as the ability to exert force. And it's not the same as muscle mass, because you can have a high muscle mass, but you may not be strong and may not be able to exert the amount of force that you need. Being strong, or having strength, enhances performance of motor skills in sport, dance, and activities of daily living. And the lack of strength tends to be a rate limiter for many skills. If you think about infants specifically, many times they are not strong enough to pull themselves up to standing, and once they develop that strength, then it no longer becomes a rate limiter for them to start the onset of walking. Muscle mass and strength. So we covered muscular development in Module 2, remembering the sigmoid pattern of growth. As you grow, you will increase your muscle mass. Strength does not always change in parallel to muscle size, as there are neurological factors that are involved. The force a muscle can exert depends in part on its cross-sectional area. Peak strength increases following peak muscle increases. Developmental changes in strength. Strength increases as children grow. Boys and girls are similar in strength until the age of 13, and more mature children tend to be stronger. Even at the same size, children of different ages will show differences in strength based on their maturation level. Improved motor unit activation with maturation does exist, and endocrine function influences strength. So as you go into puberty, you tend to have a lot of hormonal changes that exist, causing a lot of these other changes that'll cause an increase in strength. Strength in middle and older adulthood. Muscular coordination may be involved in declining strength. After the age of 50, there's a great losses in strength compared to muscle mass. The loss of strength is greatly affected by exercise and activity levels, and activity can reduce losses in older adults. So, like we mentioned earlier, in order to maintain cardiorespiratory fitness, you want to have older adults stay active. And in order to maintain strength, older adults do need to still stay active as well. Some of the effects of strength training. Before puberty, you can increase strength with training, and you can improve neuromuscular coordination, but the children do need to be monitored to avoid injury. Post-puberty, adolescents and adults could increase strength and muscle mass with appropriate resistance training. and muscle mass can be increased with training over time. We'll pause here and go into the next lecture.